The purpose of this session is both to have presentations on specific areas and relationships that domestic violence has with other aspects of women's lives, and to look at a couple of potential tools or strategies for responding to situations of domestic violence. So, without further ado, because I've just asked everyone to please sit down as soon as possible, but I think we will start with the first speaker, who is Dr. Mridula Bandhopadhyaya from La Trobe University, Melbourne. Mridula is a demographer and an anthropologist with an interest in women's health issues. She's worked in various Asia-Pacific countries on complex population health issues, and she continues to work in the areas of gender, reproductive health, reproductive rights, gender-based violence, health development, and determinants of health. She's been working with immigrant women's health research in Australia for several years. She's also worked in comparative public and social policy, education, and multimedia projects, and with the Australian public sector on primary health care and health services. She joined La Trobe University in September 2007, where she continues her work with immigrant and refugee women's health. Mridula, you have the floor. And she will speak on domestic violence and acid attacks.
Thank you very much, Kathleen, and thank you to Vinny to invite me to this session to speak on acid violence. And to be very honest, I was here on a holiday and Vinny invited me to speak on acid attacks. So my session is not going to be a very didactic one as the previous ones, and I'll be speaking to the slides. And if any of you have any burning questions or comments, you can still stop me and ask questions. I wouldn't mind, because I thought this would be a very interactive session. I'll be basically about the research I conducted in Bangladesh in 2001. And UNDP had invited our university. Previously, I used to work at the University of Melbourne in Australia, where I was lecturing in gender-based violence, reproductive health, rights, and gender issues. And we did consultations with UNDP in Bangladesh and in Nepal regarding gender-based violence, and that's where we came across acid victims, and I ended up doing a research with the acid victims or survivors, as we call them. It's doing research with them has been very traumatic, and since then I didn't want to go back and revisit that because the trauma has left deep scars even in me, even after so many long years. So anyway, I'll be just talking to the slides and just start with what is acid violence, why it happens, what damages it causes, and use Bangladesh as an example. So what is acid violence? It is the deliberate use of acid to attack another human being. And when we talk about acid violence, it occurs mainly in this part of the continent, in South Asia, and is quite common. But when I was doing the research in 2001, Bangladesh was, I think, the only country where it was happening at that point in time. So it is the deliberate use of acid to attack another human being with the sole intention of injuring, disfiguring, maiming, and blinding the victim. So the intention is to deliberately hurt that person. Acid normally has a very devastating effect on the human body because it damages the skin tissue and often exposes and sometimes dissolves the bones as well. And I have met the survivors of acid attacks, and you can hardly look at their faces or bodies. It is disfigured, and when I met them, they have had several surgical treatments and psychological counseling sessions and treatments, but still the scarring is so visible and quite traumatic, as I said earlier. So the long-term consequences of acid attacks include blindness and permanent scarring of the face and the body. Acid violence never kills really. Very rarely a person will die of acid attacks, but it causes severe physical, psychological, and social scarring. The victims of acid violence are mainly women, children, and the elderly. In Bangladesh, at that point in time, there were a couple of elderly men on whom acid was thrown because of land disputes, but normally it happens to women and children. 80% of the acid attack victims are females, and almost 70% at that time were under the age of 18 years. But things have changed and the demographic is changing. And it is a worldwide phenomenon. It is not restricted to any geographical region, to religion, or to a particular race. Attacks are most common now in Bangladesh, Pakistan, Afghanistan, India, Nepal, Cambodia, Uganda, and South Africa. And some cases have been heard in Iran as well. And it is a relatively new form of violence against women. And the earliest record, what we have found, is in Desh, which dates to 1983. When I say earliest record, this is the earliest reported case. So there may have been previously acid attacks, but it was never reported. And acid victims are often left with no legal recourse, limited access to medical or psychological assistance, and they do not have the means to support themselves. Because once you're attacked, you cannot go back to your employment, you can't go back to your day-to-day living, so you do not have economic independence. Sometimes you're ostracized, you're isolated from the society, from the community, from the family, so you have no means to support yourself or to redress or seek legal recourse. And it takes a long time to rebuild lives. Acid survivors, they need long-term care and access to a holistic program of surgical and medical support, psychological support, rehab, and advocacy. And they require, as I mentioned earlier, surgical treatment, repeated surgical treatment actually, and face numerous physical, psychological challenges as well, which require in-depth intervention from psychologists and counselors at each stage of physical recovery. So we have been debating all morning why violence against women is committed, what is happening in our society. So again, it's all gender-based violence. Someone in the audience was mentioning that men should be involved, and which is very right. Men should be involved, families should be involved, society should be involved, the government, legislation, everyone should be involved in this issue. It cannot be targeted just by, say, women themselves, men themselves, or family as such. So this happens for many reasons, and the pattern of acid attack vary from country to country. They may result from domestic disputes or land disputes, dowry demands, or revenge. In many cases, it is a form of gender-based violence, perhaps because a young girl or a woman spurns sexual advances or rejects a marriage proposal. So my contention when I wrote the paper was that it is a woman's right that she should be able to walk the streets without fear of retribution from anyone. She has the right to say no if she doesn't want a sexual advance or a marriage proposal from someone. It doesn't come from economic independence, but this is a basic human right. A woman has as much right as any man to say no. So this shouldn't happen. A woman should feel safe to walk, to say no without fear of retribution, but this is not happening in our society, and that needs to be changed. So as the mother of an acid attack survivor in Bangladesh refers to the attack on her daughter by her new husband, and there's the quote there, you can read it. She says, "The man to whom we handed over our beloved daughter with the hope that he would nurture her dreams has shattered it instead." And I'm not giving you most of the case studies, but the book chapter I wrote, it has several case studies of how women have been attacked in their own homes. So why does it happen? Gender violence is one explanation. The other one is easy availability of acids. And these acids are used in manufacturing and processing industries of cotton and rubber. And that leads to violence because it's easily available. And also men feel that if we attack the woman, she's powerless, she has a low position in our society, there's no binding legal or judiciary or laws in the society, so they would not be punished. And the chemical agents mostly used in these acid attacks are nitric acid, hydrochloric, and sulfuric acids. So like I mentioned, the weak rule of law, political corruption, and cultural and gender-based inequalities are the leading causes why it happens. And since 2001, there have been increasing incidents of acid violence in many countries besides Bangladesh. So what kind of damage acid causes? It has a devastating impact on the human body. Acid survivors are often permanently blinded and lose the use of their hands, sometimes their eyes, nose, ears, depends on where acid was poured, making everyday tasks very difficult. Without assistance, many survivors may not find gainful employment, and even with help, returning to the routines of their daily life takes years and years. Excuse me. And on a day-to-day basis, acid survivors experience limited insurance and have to deal with numerous discomforts such as skin tightness and severe itching because of the burn of the acid. And the psychological scars are not visible to us, but they are very real and very traumatic for survivors. And like I mentioned previously, many survivors do face isolation. They are ostracized from the communities, lose the ability to earn a living, and lose much of the independence they had previously enjoyed. And in the poorest countries, especially in the South Asia region, in the developing countries, women survivors face little chance of marriage if she's not married, or if she's married, employment, independent living, and which condemns them to extreme and inescapable poverty. And coming to terms with the trauma of the attack, the permanent scarring and disfigurement, and the loss of social acceptance are some of the other challenges a survivor faces. Like I mentioned at the beginning of my presentation, it is very hard to look at the face of a woman who has been attacked with acid and to imagine how she will live an independent and a fulfilling life. Yet despite these indescribable pain, disfigurement, and psychological trauma, many survivors build their lives when provided with support they need, because they are reskilled and they learn new skills, and if they get social support, survivors can be helped to help themselves to find jobs and be independent. So what has the response been so far? The one positive thing has been acid throwing has been recognized by many countries as one of the latest and most excruciating forms of violence committed against women. And since after my research in 2002, the government of Bangladesh was the first country to enact the Acid Control Act. And under this act, unlicensed production, import, transport, storage, sale, and use of acid became punishable with a prison sentence of 3 to 10 years, and the same applied to the possession of chemicals and equipment for the unlicensed production of acid. So that was one step in the right direction. Bangladesh also adopted measures to expedite the judicial process to deal with acid perpetrators with the establishment of dedicated tribunals. just as I was finishing the research, found that at that point there were, I think, between 2000 and 2001, there were, from memory, if it serves me right, there were about 383 acid attacks, and out of that only 20 cases were brought to a court of law, and out of 20, only 8 were, I think, finally processed and they were punished, and the rest went scot-free because there was lack of evidence. Cases were withdrawn, the families were scared to press charges, so you can see how grave this problem is. And Bangladesh then introduced the death penalty for throwing acid and laws strictly controlling the sale of acid. This all happened after 2002. And Bangladesh, where attacks are relatively common, it is considered mostly as a form of domestic violence. So acid violence is getting more attention in Bangladesh these days, but much more needs to be done to prevent attacks in the future and to address the needs of the victims. Conviction rates as of 2010 still remains quite low, and this data which I got, but I'm not sure if it's right, between 10 and 20%, excuse me. And Bangladesh still struggles to meet the needs of victims on the clinical front. When I was doing the research, they just had one Dhaka Medical College who used to treat victims of acid burns. But they would only operate between certain times and only on certain days. So it was bad luck if you were attacked, say, on a Tuesday. The clinic doesn't run on a Tuesday. It ran only on a Friday. So that was the situation at that point in time. And since then, they have changed the laws, and more doctors have been trained, paramedics have been trained, and there has been a lot of advocacy and awareness on how to treat burn victims when acid is thrown on a woman's face. So, but still, the lack of facilities is one of a big problem in Bangladesh. And recent figures out of Bangladesh shows that despite the low conviction rate and inadequate provision of specialized healthcare, acid attacks have come down from an estimated 500 in 2002 to fewer than 100 in 2010. But like I said, I'm not sure if attacks are being reported or not. So these figures, I'm not very sure if it's correct. So NGOs have been involved in acid attacks and response. The Acid Survival Foundation in Bangladesh is one such organization. Then there's Nari Pokho, ActionAid, and the Bangladesh Rural Advancement Committee Community Empowerment and Strengthening Local Institutions Program assist acid survivors in the country these days. And there's an International Acid Survivors Trust, which is based out of the UK and Canada, and its partner organizations are working in Bangladesh to strengthen the rule of law, to address acid and burn violence, and helping raise awareness of the issue and ensuring service delivery centers are available to support the survivors. The Acid Survivors Trust International has set up partner organizations dedicated to combating this violence at the local and national level in Bangladesh, and they also have offices in Cambodia, Nepal, Pakistan, and Uganda now. And it provides vital financial and technical support and builds local medical capacity through teams of expert volunteers. Also, it provides specialist support services through a team who work across organizations between these different countries, transferring medical, psychological, and social rehabilitation skills, and also supporting knowledge sharing and best practices. ASTI also supports its partner organizations through a volunteer network of plastic surgeons, burns and physical therapists, nurses and counselors, who then train local medical and paramedical staff and psychosocial practitioners in providing specialist care for acid attack survivors. At the international level, ASTI also works to raise the profile of acid violence with UN bodies and other key international players and actors. So, are these the steps in the right direction? Ideally, these attacks should not happen at all. And, however, given that it does happen in our society, the governments are working to make this a reality, for example, in Bangladesh. But in 2010, Cambodia has enacted a law, Pakistan has enacted a law, and Uganda. So hopefully it's a step in the right direction. Developing links with local and national media to focus attention on the problem. Running awareness raising campaign targeting males, not only Bangladeshi males, but since I'm using that as an example, Bangladeshi males. And of course, more research is needed to better understand acid violence as an international phenomenon and to identify every country in which such acts take place. To train more doctors and paramedics, need for an independent burns and plastic surgery institute, and open burns unit in the medical colleges and hospitals. And like I just mentioned, the lower house of Parliament in Pakistan passed the Acid Control and Acid Crime Prevention Bill on May 10th, 2011. And Pakistan also had an Acid Survivors Foundation, which operates from Islamabad, offering medical, psychological, and rehab support. And government of Uganda is reviewing its laws. And again, Acid Survivors Foundation operates out of Kampala to provide counseling and rehab treatment to victims, as well as their families if need be. And in Cambodia, a government committee tasked with drafting new legislation to curb acid violence was formed in February 2010 after a spate of attacks, escalated attacks in 2009. So the legislation is likely to regulate the sales of acid and can impose harsher sentences on attackers, including life imprisonment. In India, it is again a very recent phenomenon, or it has been reported recently, and media has taken it up. And many of you might know about Shireen, who founded the Palash Foundation to help other acid survivors with psychosocial rehabilitation, including moral support, reintegration program, workshops on coping skills, awareness programs, and referral system. And Shireen was attacked by her husband in her marital home, so it is a form of domestic violence. And Palash Foundation, it is located at Sion Hospital in Mumbai, and which has a dedicated burn ward, and it offers the following services: moral support, follow-up through home visits, awareness and sensitization sessions, and support groups once a month for survivors. And also runs programs on social reintegration and creating awareness on disfigurement, body image, through interactive sessions, seminars, and presentations. So in conclusion, I have just put up questions for you guys to ponder. Where to do we go from here? We know this is another form of domestic violence. What sort of actions do we need to take? Should it be just legal, social, cultural, public awareness, education, advocacy, law enforcement, or anything else comes to mind? What can be done? And I'm seeking comments from you, comments from the audience, and also people who are working in violence against women. And this is a reference of my work, which I did in 2001. If anyone is interested, I think it's available. No, it's not available. You have to buy it. But you can Google it and read it online. Thank you very much.
Thank you.